Hello, everybody. I'm Shane Tinsley, the co-founder for the Pursuit of Academic Medicine, and I have the privilege of interviewing Dr. Courtney-Hines today. And she received her BS in chemistry from Hampton University, graduating as summa cum laude, and went on to receive her MD and PhD from Johns Hopkins University, where her PhD thesis was in medicinal chemistry and biochemical research on the development and characterization of bisubstrate analog kinase inhibitors and the use of these inhibitors to determine the kinetic mechanisms of protein kinases. And recently, she completed a fellowship in the National Clinician Scholarships Program Fellowship from 2018 to 2020, where her current research focus is in teledermatology for the identification of skin cancer and increasing the access for dermatology care. Again, thank you for coming on the show, Dr. Courtney-Hines.
Thank you for having me.
Now, I think one of the main questions that are popping up in the minds of our audience is, what is an MD PhD? Can you expound upon what that means and what training it entails?
Sure. So people who pursue the MD PhD are people who typically have an interest in both clinical medicine, so taking care of patients, but are also interested in research to help advance medicine, so to find new and innovative ways to provide care for patients. So historically, they're referred to as physician scientists, but I think it's important to note that although you can be a physician scientist with an MD PhD, you can be a physician scientist actually just with an MD. And many MDs do conduct very excellent research without the PhD.
Wow, that's amazing. So you talk about research. What kind of research does that PhD entail for a physician scientist like yourself? I know you're doing teledermatology research. Is that the only thing you can do? Is there basic science or translational? Can you expound upon that?
Absolutely. So actually, my PhD was basic science. So my PhD was very much in a lab. I was a chemist as an undergraduate. So I continued to do work in and around chemistry in my PhD. And that's fairly common, but many MD PhDs do their PhD work in other areas. So public health and epidemiology is very common. Many people have done PhDs looking into more clinical research areas. And then actually there's some really interesting folks who have done MD PhDs looking at the humanities. So I've known a few people over the years who've done MD PhDs where their PhD was in history of medicine or something more in the humanities. And so it really can be very variable. But I would say probably the majority of us have PhDs in basic science.
Amazing. So having that PhD, does it unlock certain opportunities that wouldn't be applicable to other clinicians, such as that only have an MD? How does that work?
I wouldn't say it unlocks additional opportunities that aren't available to MDs. It simply gives you additional training that I think gets you off to a faster start. So if you spend 3 or 4 years doing research, I think you have a better foundation in terms of how to ask research questions and how to write grants and things like that. And absolutely, people who have just the MD can do that as well, and many of them do. But the MD PhD just gives you a deeper foundation in those research methods and thinking about how to pursue a research career.
That's amazing. And now that we have a background on what it means to be an MD PhD, can you tell us about your unique schedule, such as what you do in a day or what you do in a week in terms of doing research and teaching and clinician care?
So my schedule is really kind of variable day to day. So I spend 1 day a week where I am really just doing research around telemedicine. And then I have 2 days during the week where I'm doing remote or telemedicine for most of the day. So some of that is live, meaning I'm interacting with live patients and talking back and forth with them during clinic visits. And then some of that is what we call store and forward telemedicine, where other physicians send images of concerning skin lesions to us as dermatologists. We evaluate the pictures and then send our recommendations back to the referring physician, who then carries out our recommendations. So that's not live telemedicine. That's called asynchronous telemedicine. And so I do that for part of the week. And then on Wednesdays, I am engaged in our resident education program. So for instance, yesterday I gave a lecture and participated in grand rounds. And then today and tomorrow, I will actually have in-person clinics. So I will see our patients in the clinic here at the Detroit VA. So it's a real, each day is a little bit different. Some days you're seeing patients live in person, some days you're seeing them live virtually, some days doing asynchronous telemedicine, and then other days doing research. The nice thing that I like about that is it gives me a lot of variety in terms of what I do from day to day.
That's amazing. And it comes with a lot of skills and versatility that comes with being a physician scientist and a physician educator. So can you tell me like specific like skills that you think are like critical to being so busy and having so many responsibilities in academic medicine?
I think just in general, I think really being highly organized is really important. And I think it's important in terms of getting through these types of programs, training programs, and then, afterwards being successful in whatever you choose to do. But I think the other things are building good networks, meeting lots of different types of people who do different kinds of things, be it in research or clinical medicine, because it helps you to build collaborations and get new ideas about things that you might want to do. I think that being open-minded and curious is really important because sometimes great things come just from happenstance interactions. And if you're curious about the things that you see, it often opens doors and unlocks opportunities for you.
That's amazing. And I want to expound upon what you said about collaborating and networking. How would one go about finding a mentor in academic medicine when they're trying to really start up their career?
That's a great question. I think that there are a lot of different kinds of mentors, and that's the first thing to recognize is that there are people who may be academic mentors who may be helpful in terms of guiding you along your academic or career path. And then you have people that are more life mentors and talk with you about balancing different kinds of things, academic life and personal life. And so the first thing is identifying what kind of mentor you want, because that's really important. And then as you identify the type of mentorship that you would like to seek out, then identifying people who are further along on the path than you, and particularly if you're looking for a career mentor, people who are in the place where you hope to be in 5 or 10 years. And then it's always, I think, helpful if you have commonalities. You don't have to have that. And in fact, some of the most important mentors in my life had no commonalities with me. We're very different folks from me, but just happened to take an interest in me. But if you have those connections and commonalities, if you are in the same organizations or went to a school together, those things kind of help to build relationships and can be sort of a door to kind of building that relationship, getting your foot in the door.
That's amazing. Now I want to shift perspectives. What would be the best attributes that you can come in as a mentee when finding a mentor?
So I think as a mentee, it's really important again to know what it is that you want to get out of the interaction. And so when you're coming to interact with your mentor, having specific questions, specific goals, specific things that you are seeking help to achieve, that's really helpful because the mentor doesn't know what it is that you want. They can't read your mind. So you have to really come with a sense of what it is that you want to accomplish. And then that gives them makes it easier for them to help you get to where you want to go. I think the other thing is to be motivated. So when people give you suggestions and ideas, making sure that you follow up on those things because that helps to make sure that the mentor feels like you are making good use of the networks and things that they're opening up to you. Our networks are very important. And when we open our networks up and people don't follow up, that can sometimes make it hard to make that connection for a future student. So making sure that you as a mentee are following up on invitations and connections and really making use of the opportunities that you're being given by your mentor is really important as well.
That's amazing. Because can you like give us an example about how one of your mentors has been so profound in your trajectory in academic medicine? Did they you
Hmm.
have a career interest in terms of research? Did they make you want to specialize in a specific clinical issue? How did that work for you in terms of your experience?
So I would say probably one of my most important mentors over the years was my PhD advisor, Phil Cole at Johns Hopkins. And Phil was really important to me for a number of different reasons. And the first was he took a real interest in me as a PhD student. So one thing that's a little bit different about my story was that I came to Johns Hopkins actually as a PhD student. I came in with the intent of just pursuing my PhD. But then about a year into the program, I realized that a lot of the questions that I was interested in really had a lot to do with clinical medicine. And I was interested in more clinical trial work, and those kinds of things had a close tie to clinical medicine. And I felt like it might be easier, or I might have a better perspective on some of these questions if I had the MD degree as well. And so the first thing was that when I came to him and told him this, he was very supportive. I think sometimes mentors want you to do things that they want for for themselves. Like they want their mentees to be successful because that's a reflection of them and their success. But the best mentors are the people that want you to be successful at what you want and are going to support you doing what you want to do. Those are the very best mentors. And he was that kind of mentor. So even though it potentially meant that I was going to leave my PhD and leave early and go off to do medical school, he was supportive of that. If that's what you want to do, then let's talk about it and find a way to get you there. Now, as it turned out, I was accepted to medical school at Hopkins. And so I stayed and I did both degrees and I completed my PhD and I completed the MD. But, had it not worked out that way, I probably would have left. And he was, even despite that, perhaps not looking best on his TV, he was supportive of that. So that was the first thing. The second thing was that later, as I got towards the end of my training, and I began to realize that I was interested in a different clinical area than I'd started out. I came into medical school really very clear I was going to do internal medicine, and I had a strong interest in endocrinology. But over time, I became more and more interested in dermatology, which I always tease. I blame it on his wife because his wife is an academic dermatologist. And I spent a lot of time with her over the years. And she sort of, I say she turned me to the dark side. But she was, very instrumental in that interest. But when I made that change, Phil, my PhD mentor, was again very encouraging. Was like, if that's what you want to do, then that's great. And so along the way, he was very supportive of the different kinds of career choices that I made and helped to be a support and an advocate for me along the way. And so I think that's really, really key and really special thing is when you find a mentor who will support you in what you want to do and wants what's going to make you happy and not what's going to look best for them.
That's amazing. And I think you brought up an interesting point that I didn't know earlier. You did a PhD in a research area that wasn't where you're doing research currently. Is that possible when you're getting an MD PhD?
I'm sorry, can you repeat the question?
I am so sorry. I was asking the question of you did your PhD thesis in an area that's outside your specialty. Is that possible when you're trying to get an MD PhD? How does that work?
Well, you got to remember when you're doing your PhD, you don't have a specialty yet. So you're still medical student. So you're kind of undifferentiated. You can kind of do whatever. At the time when I was doing it, as I said, I was interested in endocrine. And so I was looking at the insulin receptor signaling and signaling through tyrosine kinases. And so I was doing all of this work around insulin signaling because I was interested in endocrine and potentially doing diabetes research. And as I said, in the end, I decided to do something completely different. And that's okay, because it's interesting, here we are many years down the road, and many of the pathways and drugs, these kinase inhibitors that I worked on many, many years ago, are now becoming hot medications in dermatology. So you never know where things may come full circle. And so it's been a really interesting story over the last 10 years or so to see this class of drugs, which was really in its infancy when I was working on them, now being FDA approved, being widely used, and increasingly having really important roles to play in dermatology in terms of alopecia and vitiligo. So medications that diseases that didn't have any really a good or effective medications. And now this work that I did many years ago, you can see how it's, in some ways relevant to what I'm doing now.
Wow. I just want to give you kudos for the amazing work and seeing how it all came full circle. That is truly a blessing, and that's amazing to see. But now my question is, with all your accomplishments you've gained thus far, what are you looking for in terms of your later career trajectory? What do you see?
That's a great question. I think over time your interests change and what you want to do changes. I am interested in taking on more administrative roles. One of the things that I've done over the last few years is gotten interested in the use of telemedicine as a way to expand access to care. In dermatology, it's a real issue for us because there are tremendous wait times for patients to get in to see us. As specialists, there are not very many dermatologists, and we tend to be geographically clustered in big cities. And so for people in rural areas or low income areas, it can be hard to get in to see a dermatologist. And so that led to my interest in telemedicine. And of course, with COVID-19, the interest in this has really sort of, exploded. But even before that, I thought that this was a really powerful tool to help open doors to patients in terms of getting them into specialty care that they might not otherwise have access to. And so I think over the next few years, one of the things I'd be interested in doing is figuring out innovative ways to build these kinds of consult networks and, using telemedicine to help increase access to care. And that's really more of an administrative operations type of role. And so those are the kinds of things that I'm looking into, in terms of future work.
That's beautiful. Again, the versatility and what you're going to be doing in the future is really exciting to see how you can start off as one thing and then slowly but steadily like venture off into various interests in just one specialty too. I think that's
Mhm.
beautiful. Medicine is so many opportunities.
Yeah.
But now as we come to the end of our interview, do you want to leave our audience with any tips or advice in terms of going in academic medicine? Any
Yeah,
obstacles?
I guess I would say that, it is it's a long path. And so be prepared, for it to be a long journey. But I think the key is to hopefully you're enjoying the process. You're less focused on the end goal and just enjoying the opportunity to learn new things every day. Like, one of the great things about academic medicine is that each day you're learning something different. And honestly, teaching young physicians and medical students really keeps you on your toes. It keeps you learning and make sure that you don't get old and rusty. So I think, if you're kind of open to the idea of constantly being, as they say, a lifelong learner, then academic medicine is really a great path if that's something you really enjoy doing.
Amazing. Again, thank you for being on the interview again, Dr. Courtney-Hines. It has been a pleasure speaking with you today.
It's been my pleasure to be here. Thank you so much for the invitation.
All right. And thank you, our audience of the Pursuit of Academic Medicine. You can continue to find our videos on our YouTube domain at the Pursuit of Academic Medicine. Thank you.